Good to be here.
Thank you. Well, we are at 10:31. People are coming in. So I think in the interest of time, we are going to start this call. And then please feel free to introduce yourselves in the chat box, especially if you're new here, but even if you've been for our earlier calls, it's always nice to know who is in the room. So please use the chat box. Welcome. I am Gunjan Veda. I work with the Movement for Community-Led Development, and I will be facilitating today's call with Nellie Mecklenburg from the Institute of State Effectiveness. Some of you may know we started these calls in April last year, and they were a direct response to a need that a lot of movement members expressed on, there was so much changing with COVID, with the lockdowns, with everything that was happening, and all of us were going through similar problems. And we felt the need to create a platform where we could think together, where we could learn from each other, a space where we could all reflect, maybe adapt, co-create solutions and ideas, and collect information. And this emerged as that space. This is going to be our 10th call. My apologies, I know the invite said it's the 11th call, but it's actually our 10th call in the series. We have some very simple rules. As I mentioned, that this platform was really created for us to work together. It's a space for reflection. So it is what we make of it. We've continued having it here just because everybody expressed the need to have the space. So please participate. The chat box is your best friend during this call. Feel free to share introductions, ideas, reactions, thoughts, suggestions, comments in the chat box. Raise your hand if you would like to speak, and we will make sure that you are there. My colleagues are going to be monitoring the chat box. They're going to be monitoring the participant list to see if anybody wants to speak. But really, this is an informal space where all of us share and try and work through some of the issues that we have been facing together as a sector and as a community. So that's really the overview. So the only rule is please keep yourself muted, because as the number of people on the call increases, we don't want a lot of background noises coming in. But otherwise, participate with the chat box, participate by raising your hand. So we started these calls in April last year, and since then we've done a number of things. When we started out, most of us were just going into lockdowns. And the immediate problem that faced us was like, what are the kind of problems we are facing with these lockdowns happening, right? How are we going to carry on the facilitation? How are we going to carry on our work? How are we going to respond to the needs in our communities, the new needs that have emerged and that the community members are expecting from us? And over the course of the last year, we've gone through some of these things. We've done scenario planning sessions to prepare ourselves better. We've looked at barriers. We've learned from each other how we are tackling different barriers. We've heard how organizations have had to pivot, sometimes by providing things like food and necessities, which they haven't been doing traditionally in their communities because there was a need. Sometimes by looking at manufacturing or creating masks and sanitizers, by doing information campaigns, by moving suddenly into the telecommunications space. So we've heard all of that. We've heard of some interesting innovations to share information, like the radio program, which the Malawi chapter has been doing. We've heard of different chapters and organizations working with governments and the kind of working groups that they have created to respond to this. If you're new to this call, then we do have a COVID resource page on the movement website, which curates not just all the call recordings and all the ideas that have come from the call, but also other resources from chapters and different organizations. So please feel free to visit the page and see there's a wealth of information that we have, actually all of us have created together, and it's there for everyone. So like I said, we started with addressing the immediate needs and responses. We looked at things like scenario planning. When the vaccination thing started, we got people from the World Health Organization to come and talk about, what is it going to look like? How do we access vaccines? How do we access information about the vaccines so that communities feel confident in taking the vaccines, but also that they know what to expect and when to expect the vaccines? We've shared We've shared progress made by the African Union CDC. We've done all of that. But the last 2 months, we actually did not have a call because we were reflecting on what is going to be most useful for us in this space. And we reached out to many of you. Thank you to those of you who shared ideas around this. And what we realized is that it's been a year now since the pandemic started. When it started, I think somewhere all of us expected that, well, this is really bad, but this would pass. And so everything was about gearing ourselves to that immediate response, the immediate need, masks, food grains, sanitizers, immediately setting in place what was needed, information to respond to the crises. And then vaccinations, information around that. But I think somewhere along the last year, as many of you have been telling us, we realized that the pandemic is not just short term as we expected it to be, but also that our world has changed irrevocably. Even when the pandemic ends, even with everybody vaccinated, the world is still not going to go back to what it was. There have been a lot of problems. We've gone back, we've had a lot more people who are now living with hunger and poverty. We've seen how violence against women has gone up. We've seen how the progress and the strides that we made in different sectors, we've gone back because of the pandemic. But we've also seen that the pandemic has been a window of opportunity. The pandemic has, more than anything else, showcased how and why communities need to be in that leadership position and in that seat. It's kind of really strengthened the shift the power movement in international development. It has had donors and governments increasingly talking about and recognizing the need for communities, community-based organizations, and local organizations. So there's a lot that the pandemic has changed in our world, and that will be changed even once the pandemic goes away. So this call, and we hope the subsequent calls now, are going to be about a space for us to reflect about, well, now that we know that the world has changed, what does this mean for us as organizations, as individuals? What does this mean for our programming? What does this mean for the work that we do? What does this mean for the goals that we have set for ourselves as individuals, as organizations, as a community of practice, as a movement, as sectors? What does this need from us? And a lot of you have told us that there really hasn't been a space to think and reflect about this because we've been so busy with immediate response. And that's true of any emergency situation or any humanitarian situation. But it's equally true that we need to now think long term, and we hope that this space will allow us to do so. Can we go to the next slide, please? So the agenda for today's call, I'm going to give you a very quick update on the COVID working group because since I think May or June of last year, we've actually had a working group. They've been meeting regularly. We've been doing some great research. So I'll give you a quick update about that. We'll have a couple of polls, and then we're going to hear from the field. We are going to hear some participants share with us what has the pandemic meant long-term for them, their organizations, in their countries, in the areas where they work. We are actually going to then move into the breakout groups where we will reflect like we do on some of these questions. We'll come back and then we're going to finally discuss how do we want to design the space going forward? What do we want to do in our next call? What is going to be most useful and most meaningful for us? So that's the quick agenda for today. The working group updates. So we have an active COVID working group. And one of the things the COVID working group decided to do, John, we can go back to that. Yeah, thanks. So one of the things that the COVID working group decided to do was that, well, the pandemic offered a wonderful opportunity for us to understand community responses. Which communities responded? How? Why? Why were some communities mobilized quickly? Why were some communities not able to mobilize as quickly or as effectively? Who are people listening to? Who are they trusting? What does this mean for us going forward in our programming? So the COVID working group has been actively researching these questions. Over the last few months, we've had different members of the group go out and carry out interviews in communities with different community members. We've looked at the studies which have already been conducted, because one thing that COVID has done, again, in terms of the window of opportunity, is that a lot of us carried out studies on the gender impact. We looked at the health impact, the education impact. We looked at the impact of community-led development because of COVID. So we suddenly also had more data than we've had in the past to understand what's happening in the field. We need a lot more data, but we also have more data than we had. And the COVID working group started collating this information, these various studies that different organizations in the movement have been doing, alongside the first, the primary research, which was the field interviews. We will have a set of case studies coming out of this that will look into community responses, into what triggered those responses, into information sources that they trust, and all of this information coming out in about 2 months' time, we hope. So that's the working group update. Before we launch today's, we get into the meat of today's call, which is really talking about some of the long-term changes, what's been happening, and hearing from people. We wanted to do 2 quick polls to understand where are you on this. Can somebody, okay, for some reason, I am not able to launch the poll. Nelly, are you able to launch the poll?
Yes, I am, but it seems...
You have to go to poll 2.
Got it. Okay, I'll launch it right now.
So you're going to see 2 short questions on your screen soon. Apologies. One, I think we still have technical difficulties, howsoever much we use technology. It's one of those things that just doesn't go away. But what we're trying to understand in these questions is, A, to see, have any of us really had the time and space organizationally to start reflecting on long-term consequences or long-term adaptations, long-term changes? Nelly, are you able to launch it?
They're launched. There's 8
can...
people have responded so far. I hope you can all see it.
For some reason, I don't see
10
it.
people.
Okay, we're going to give people a few minutes to respond. A minute to respond. And then Nelly, you would probably need to share your screen to share the results. Not share your screen, just share the results.
Yep.
So maybe give people 40 seconds more to respond.
Yep, and on the, so the first question, as Gunjan said, is whether you've had time to reflect organizationally on sort of how long-term priorities and goals may have changed. And the second question is, what are some of the areas, the specific areas in your work where you think these changes are happening? We're seeing a lot of people respond that on community engagement approaches, there's been changes on the way the office operates, on funding approaches and how you access funding, as well as on what the priorities of the community are. I can see these results, but you all can't. So we'll just give it another moment and then we can share.
And if there are other things that have happened, please feel free to say, put that in the chat box, because there may be other changes that we haven't been able to capture here. And also because Zoom only allows you to put 10 options.
Yeah. Okay, we've had about 70% of you vote. So Gunjan, I might go ahead and end the polling and share it. Can you all see that? Great.
I can't, but I am sure everybody else can.
I can give a quick summary then.
For some reason, I can't see it.
So actually, which is great, the majority of people, 74% of the people who voted said they have had time in their organization to take a step back and think about how the past year has changed priorities and goals. In the different specific areas, most 61% said they've changed on community engagement approaches, the way that they engage and interact and communicate with communities. 57% say the priorities of communities have changed, as well as the way that their office operates, maybe how people meet and how they work together. 48% have said funding approaches have changed. Training, 40%. And there's been less changes on the priorities in the sector overall, less on procurement, less on how they collaborate with government. So we will document this and share it with the notes. I'm going to stop sharing the results now.
Thanks, Nelly. And Annette actually pointed out another one, which I think was very interesting, which is, and very true, better visibility and access to participatory opportunities on a global level due to increased virtual meetings, conferences. That's actually very true. I think we've been able to virtually participate in so many more events in so many more places because of the meetings being virtual and not having had to travel. So funding and other restrictions suddenly are no longer as acute for travel. But that's a great one. Thank you, Annette. So please feel free to put in any other such points that you can think of. And Nelly, over to you.
Great, thank you. And John, do you mind putting the slides back up? So to launch our discussion today on this topic, on how our work, the sectors that we work in, the communities that we work with, how they've, what changes have come out over the past year that are going to stick with us, and also what issues that have been revealed during this time that actually existed before. We're going to hear from two of our members to just start us off, and then we will come back for a discussion as a group. So as they are speaking, if you have questions, you can put them in the chat box. We'll monitor that, and then we'll open it up and you can feel free to raise your hand or unmute and speak. So first, I want to introduce Suhaila Bazbaz, who is the Director of Community Cohesion and Social Innovation in Mexico, and is also a part of the Mexico chapter of the Movement for Community-Led Development. Suhaila, are you
here?
Yeah,
Nelly. Thanks
Perfect.
for the invitation, and I'm very glad to see you all and to have this conversation with you. I think COVID has changed in three ways our work at Community Cohesion and Social Innovation, and I'm going to refer to the work we carry out in one specific initiative, which is an initiative that we started last year before COVID to reduce power and information asymmetries faced by indigenous peoples, to participate and determine decisions related to specific projects and problematic projects from agro-industrial, energy, extractive sectors, and others. So I'm gonna say the three ways in which COVID changed our work, and then I'm gonna explain them briefly. First, it changed how we make decisions in a changing context. I know this is quite obvious, but it's here to stay. We have mainstreamed uncertainty as the new normal because change is not over. The world has changed, but change is an ongoing situation. It's not that change is already finished and now we need to adapt, but we need to adapt to change as the new normal and uncertainty as the new normal. So in order to decide whether we can facilitate participatory processes in the territories, we are now considering different types of variables on a regular basis so that we do not rush into decisions, for instance, deciding that we cannot go to territories or that we should go to territories and that's the end of the discussion, but how to take into account different variables every week, every day to make ongoing decisions. The second way in which it has changed our work is because it changed what we take into account to decide. For instance, we had to do a research on sanitary infrastructure just to understand the different risks that the communities were facing if we were going to facilitate a participatory process. In many of the municipalities in which we work, they do not have one single bed to deal with patients in COVID. They need to travel 2 hours, 3 hours. And if we wanted to facilitate, and we want to facilitate participatory processes, we need to take into account those structural inequalities that have widening in this context. And third, it has changed not the priorities in which we work, but different factors that we take into account. For instance, what was last year a constraint in our work is now a part of the realm of our action. And we have identified how governments and enterprises are using COVID as an excuse to violate human rights, specifically the right to information and the right to participate in the decisions regarding the territories. We are putting focus on how economic recovery is being used as an excuse to further the imposition of specific projects in the territories without considering the right to information and participation of indigenous peoples and other human rights stakeholders. And finally, I think one issue that keeps worrying me, and we have discussed it like in general terms in the team, but I would love to hear your thoughts on it, is the balance between physical and mental health in the communities, but also in our team, and the implications on mental health that this uncertainty, continuous uncertainty, is having. I mean, I think we have been great to adapt and to mainstream this uncertainty, but it has an impact on all of us in the team.
Thank you so much, Suhelia. And I think those are all so pertinent and probably apply to all of our work. And I saw in the chat, someone also, Annette, commented on this, but I love that line, mainstreaming uncertainty as the new normal. I think that's one of a critical way that it's changed all of our work, but also, as you said, thinking more about how government and other partners come up with these excuses to exclude communities. And COVID is one of them, but they keep finding new ones. So I thought that was, thank you for raising those. I then want to invite Arthur Nkosi, who is the country director for Core Africa in Malawi and is also the co-chair for the Malawi chapter of the movement.
Great. Hello, everyone. It is a pleasure to be here and to be amongst all of you. My topic will be mainly around education, but before I start, let me just talk a little bit about myself and the chapter that we have here in Malawi. Our chapter is still growing, and currently we have up to 20 different organizations that are represented. And as a chapter, when we hit the COVID pandemic in March of last year, we came together to try and figure out ways on which, how can we be more engaged with the Malawi government in terms of understanding the COVID pandemic. We went through months and months of trying to figure out how do we find the right government officials to be able to work with on communicating about COVID-19. And as all of you know, once COVID hit our countries, everything was on the fly, everything was on the go. And we were trying to move as quickly as we could, one, to understand the pandemic, two, to figure out, how many people are being affected and how do we protect ourselves. But most importantly, how do we, as community-led development partners as well as practitioners support those that are in the most rural parts of our countries. And as the CLD with the Malawi chapter, what we did is eventually, after I would say about 10 to 12 months of continually trying to knock on the government's door, we came together and we were able to do a broadcast of the COVID-19 post now coming into the vaccine. To share with you more about how we managed to do this, we were able to bring together different partners within our community-led development chapter to talk to various individuals who were able to link us with the media companies, 2 big media companies, and we were able to bring together a vaccinologist and 2 medical doctors to come on air and talk about the myths that are going on around the vaccines, more especially. Prior to this, we allowed the general public of Malawi, citizens in all districts and different parts of the country, to call in and ask questions so that they would be able to express their concerns about the vaccine. I'm sure most of you in your countries have heard a lot of stories about people saying, well, the vaccine seems like it's a tracking system. Once you're injected with it, they'll be able to track you wherever you are in the world. The vaccine may have effects on those that have underlying illnesses. And so there was a lot of different concerns around this. So we were able to come together as a CLD and do a broadcast and answer all these questions. Positively, it has made an impact where we are now getting a lot of attention from large organizations, such as WHO here in Malawi have come to us, World Vision have come to us, and they've said we would like to partner with CLD to broadcast this information to other radio stations around the country, since media is one of the biggest ways that people, especially in rural areas, are able to get access to information. So just to share with you on that. And then post-COVID, as we're going in, as Gunjan has said, and other colleagues, while education support has been identified a high priority, especially for the organization I'm with, which is Core Africa, we have had to look at ways in which we can set new challenges working with the Ministry of Education, with support from organizations, big organizations like UNICEF, to begin a program of broadcasting information via radios, via internet for many young learners that are especially in the rural areas. We've been working with different organizations such as MasterCard, where we were able to look at technology. We need to now start looking at the new normal and looking at how can we maximize on technology to provide education to those that have been affected by the COVID pandemic. Politically here in Malawi, as the final say, is that many of the schools, even though government has said we should open up the schools, many teachers are still hesitant to go and teach in schools because of this pandemic. And it has brought a lot of challenges between government and local government workers, mainly being teachers, to continue to educate many of the children that are in the rural areas. So as community-led development, we're still looking at ways in which we can tackle this challenge. And I would love to hear from many of you how you are handling this situation in your countries. How are you going about to manage continued education for those that are less fortunate in rural areas? So let me stop there and thank you very much for taking the time to listen to me. Thank you.
Thank you so much, Arthur. And I think those are great points on how the kind of access to partners and the kind of collaboration has changed in COVID and may continue to be different, and also the issues around access, particularly in education, but I'm sure also in other services that COVID has exposed. So I want to open it up to hear from some of you. We will have a lot more time in breakout groups to discuss this and reflect on it, but I'd be curious to hear if anyone has any comments. And or questions for Arthur and Suhelia. And I will ask Anne in one moment if there's anything from the chat box, but I first wanted to put Pascal on the spot. Pascal is the West Africa coordinator for MCLD. And if you don't mind, I think it would be great to hear how, from a chapter perspective, how you've had to pivot or how it's changed the way the chapter works together and advocates going forward.
Yeah. Thanks, Nedi. Hi, everyone. Yeah, before sharing about how we foresee our involvement in the response to COVID-19 in Benin, I will talk about Benin cases. I will not talk about West Africa, but I will talk about from the Benin CLD perspective. Before I come to this, I will say that it comes in the frame of the strategic priorities for the Benin CLD chapter to play the highest leverage role in fostering resilience for communities and to contribute or to support the achievement of the overall frame of sustainable development goals. First, we have distinguished three foundations or three pillars. The first one is governance and leadership through the lens of the CLD principle, or the 11 characteristics defined by the CLD. Those ingredients are needed to foster accountability, inclusiveness, responsiveness, participation, transparency, and I will really mention and emphasis on gender equality and the mindset model. That is the first foundation. The second foundation is the main traits we have really identified. One is COVID-19, second is nutrition, third, climate change, and the third pillar is local economy development. All those pillars to support the resilience for communities in terms of social development, in terms of economic development and growth. That is the frame. And then when we come to COVID-19, Gunjan earlier have said that information is crucial to respond to COVID-19, to respond to any crisis. In the Benin CLD chapter has come with this priority to make available needed information for communities, needed information for every stakeholders to be really efficient in responding to COVID-19. And one, we have identified a document prepared by Tostan, which is operating at West Africa level, and who has developed a material called Protect Our Families and Communities from COVID-19. We are developing partnership with Tostan, and this material is already made available and could be part of a compilation of documents that we would like to make available. So the first part of in terms of information is about awareness, making sure that communities know about COVID-19, what it is, how does it spread out, and how we could take needed measures to prevent ourselves, our families against this. That is one. The second, in terms of information, is the poster made available by the government, and we contribute as chapter in improving that poster. That is one. And one poster, the second poster is one developed by our chapter. focusing on the lifestyle that induce, that support immune system to prevent or to prevent against COVID-19. And I will briefly mention that this poster focus on nutrition, number 1, 2, physical exercises, 4, 3, stress care, 3, and the last part is adequate sleep as needed ingredient to support the immune system during COVID-19 pandemic. 3, that is 1, the Tostan document. 3, I talk about the post. 2, I talk about the posters. The 3 is nutrition during COVID-19 time. And we have been in contact with the university here through a society called Society for Nutrition. That is academician, people working with academia are part of that society. And they have developed a document to support immune system through nutrition during COVID-19 time. And this document will be part of the compilation we will be made it available for communities and every stakeholders involved in COVID-19, fighting against COVID-19. And the last part, that's it, the last part I will mention is information on the vaccine in Benin. And we are working with IRSP, that is a health foundation, which will be making available those information. And we are really, will be really grateful for any source of information about COVID-19 that we could use at the our Benin CLD chapter for that purpose. Thank you.
Thank you, Pascal, very much. And I think one thing that comes so clearly through your intervention is it highlights how important accurate, accessible information is.
Yeah.
So I know that there's been a couple of questions in the chat box from Anne and also from Tashome. I apologize if I'm getting your name wrong, but Tashome, do you want to unmute and ask your question? I think it was
Tashome.
Tashome, thank you very much.
Thank you. I want to ask Arthur, I'm not clear. I think education, when he said about education, that the government is in Malawi, there are some children who are getting education and there are some who are not getting. That means how this could be possible, because education should be a public good. I want to understand the real problem. How the government allows for some children to go to school and for some children not to go, because that is a public good. And I think this to want to know this. Yeah.
Great, thank you very much, Tashome, for that question. You're very right. It is a public right for children to be able to go to school. The challenge has been that the Malawi government had made a public announcement that all schools should open, and with COVID measures put in place. There are a number of organizations that have been working with the schools to make sure that sanitation stations are there, making sure that all the students are wearing masks and so on. The challenge has come where teachers in various districts of the country in the public schools have raised concerns on what we can say a COVID allowance. That's what it has been called. And it's been a political, well, not really a political battle, but a battle between the Ministry of Education and the teachers, saying that we don't necessarily have a policy around giving allowances for COVID-19 or risk allowance, if you could call it that. And so again, there is a Teachers Association Union that is coming together, and there have been talks with various members from the Ministry of Education to try and resolve these matters, and it's still ongoing. But you're very right. I mean, I would love to figure out a way in which, you know, community-led development, how can we come in and support this initiative so that we can find a equal balance between this? Because yes, it is a right that every child should be given education, but at the same time, you've got teachers who are also concerned. I hope I've answered your question.
You did.
Thank you, Tashome, and thank you, Arthur. And I see in the chat box there were some other good comments about, Anne was noting, you know, this question around access to education and how that might change the way that we support education in communities. And Deanna was noting about mental health, and you know, that's something that's so often overlooked and stigmatized, but COVID has put more of a spotlight on it. So how do we support it? We're going to have a lot more time to discuss this in smaller groups. So we're going to, in just a moment, move into into breakout rooms. We'll have 3 breakout rooms, and we're going to look precisely at these questions. What have been some of the long-term changes or longer-term issues that have been exposed during the past year of COVID in your organization, in your sector and area of work? Which of these changes do you think are here to stay? And John, you can actually put the slides back up. And how do you think you might have to adapt the kind of work that you do to address these changes? So in just a moment, Richard is going to launch the breakout rooms. A little window will come up on your screen, and it will tell you that you're being moved. In each room, there's an assigned facilitator and note taker who will be able to assist with anything. And please just remember to record the session when you enter and to identify someone who can share back to the group when we come back for more discussion in a little while. We'll have about 25 minutes in the breakout groups. So Richard, could you please go ahead and launch us? More people coming in. Welcome back, everyone. Hi, Gunjan.
Okay, we are going to give everyone just another few seconds to come back, and then we will launch into our discussion. And we are going to start with key takeaways. So if every group can have one person share, it doesn't necessarily have to be a summary or anything of the discussion, but just to maybe share that one key takeaway or something that stuck. And if you're prepared to do a summary, that's also fine. Whatever you're prepared to share, but maybe take about 90 seconds or 2 minutes each for each of the groups. And then we can have a much broader discussion. So group 1, that's us, Annette.
Okay, so we talked in our group a lot about food security, food insecurity, that is so basic in our world, COVID and beyond, and certainly before. A lot of this revolves around climate change, disasters, and that always has repercussions on food supply. So that is something that was percolating below the surface before COVID, and well, below and sometimes on the surface, but now it's indisputable. So we need to be careful. We talked about with making sure that provisions, relief provisions are incorporated, that the communities should be thinking about, and we should be thinking about ways you can prepare for disasters, including pandemics. So I think the climate change is something that that we focused on, particularly within a food security vantage point.
Thank you so much, Annette. And Cassidy, I am going to request you to share in the chat box the link to some of the work, because we also asked people to share if their organizations had already done something on this, and Cassidy did. So please, if you don't mind sharing it in the chat box. And meanwhile, can we have group 2 now?
Okay, thank you very much. I'm representing group 2. In group 2, what we discussed was that in terms of changes, we've seen enormous, inequalities, in health access, especially that has faced USA, and that is also in relation to racism in terms of politics and practices, or policies and practices. We also have seen changes in terms of new approach to new ways of approaching the communities as a result of the pandemic. We have also seen the people coming together and strengthening the unity for the purpose of achieving facing the pandemic that we are currently facing. So you find that there's strengthened unity among the community members, among the civil society organization as a result of the pandemic. Also, the concerns about vaccine is also something that is coming in. Some people are not sure whether to take it or not. Then we have also seen changes in terms of use of technology. I think before the pandemic, we used to use technology, but not as much as we are using now. So we have, so much increasing. We are increasing using technology more than the way we used to do it before the pandemic. These are some of the changes that we've observed. Then in terms of which changes are likely to continue with us to stay, the use of technology will stay. And this is what we've discussed as a group. We are also saying there's the strengthened unity in terms of people coming together and working together will also stay. That will also help the community move in the right direction. And also, what do these changes mean to us? It means as THP family, as a movement for community-led development community, we need to ensure that at least we adopt to these changes and ensure that at least we align our programming into what is prevailing currently in our global world. Thank you. That's what we discussed. We didn't finish everything. Thank you.
Thank you. That's very helpful, and some great points there. And we'll come back to them in the discussion. But for now, I want to request Group 3, if somebody from Group 3 can come and share what your discussion was.
Yeah, I'm gonna go. Most of our conversation centered around communication, both the drawbacks and the new opportunities due to COVID. A lot of people in our group talked about how, methods like using megaphones and radios and social media and other technology has really both helped in communicating the risks and key information about COVID, but also how they can see that being used in the future for other non-COVID programming. That also relates to work from home and in what that means. And again, there's some drawbacks and some opportunities there. Nelly brought up a great point that we found out that a lot of roles that field staff who were based at headquarters were doing in communities can actually be fulfilled by community members themselves, and it's another way to empower those communities. But also, in-person interactions with people have drastically changed, and we're both asking, especially what we've deemed as essential workers, to provide services in person, but also that means a different thing now, and it's kind of this dichotomy of what in person means. And all of that comes back to investing in people, and continuing, that investment is going to be a key consideration. the other thing I'll mention is that there's a lot of underlying issues that like others have mentioned were key issues before COVID, but are really being exacerbated now. Things like inequalities in education, violence against women, and issues of nutrition are all going to be key factors for any kind of programming, no matter where it is. And tackling those issues will need to be part of any type of long-term COVID response.
Thank you so much, Chris. And so we're going to, as always, when we share the takeaways and the minutes, we will share these breakout sheets and links to them, because we feel these are ideas for us to think about as we move forward. But I wonder if anybody here now wants to come in, having gone through that discussion. Some of the things that emerged very clearly were that, well, these inequalities are not new, the barriers are not new, but the pandemic really resurfaced them and kind of forced us to acknowledge them and their consequences. And so it does offer us an opportunity, both in terms of, well, I know John always quotes Arundhati Roy talking about the pandemic as a portal. So we don't need to go back to business as usual. There is increasing realization in that, So we invest more in people, but we also have infrastructure that was created to respond to the pandemic, the telecommunications networks, the megaphones, the groups, the different ways of reaching out to people, which can continue to now serve and, to make access easier. But does anyone else want to talk about anything that I'm curious if any organization has systematically looked at? What does this mean long-term for us in terms of how we need to change our work? And I know that Cassidy in our group had talked about some things that Outreach International is doing, how they went to the communities, they did surveys, and how they realized also that the focus needs to change a little bit in terms of, maybe looking more at employment and livelihoods, because food security or insecurity really has emerged as such a major issue because of the loss of livelihoods. But I wonder if anybody else has anything. And Deanna, I think you had a point. Do you want to bring that up?
Yeah, it's related to this last part that you were mentioning, actually, that I think it was evident for some people, but now it's even bigger, the way that it's out there about the link between health and food systems and how to manage that. And for example, in like bank seats, or how to develop resilience and more capabilities into the local communities for really having for producing their food, but also how to change food system in a broader way, like the right to food, local food, healthy food, and it was about that.
Thank you, Deanna. And I'm going to invite anyone else to intervene in just a minute, but I do want to say that because our group also talked a lot about food security and food systems, we do have a window of opportunity. And that window of opportunity is the Food System Summit, which is going to happen. And as a movement, we are actually going to organize a dialogue on community-led food systems. We are also going to, over the next few months, increasingly work towards this. So if anybody is interested in this, is working on this, then please feel free to reach out to us. And we can talk together and see how do we ensure that the Food System Summit takes into account some of the changes that need to happen to ensure that there is equitable access. So do get in touch with us if you are working on this or are interested in working on the Food System Summit. And
Gunjan, just let me add on that point that our global call, the big global call that we have on the 31st of this month, that will really focus on the Food System Summit and kind of immerse ourselves in it. We're going to try to get some of the big wigs from the Food System Summit process to brief us and be able to launch that as a big conversation in the movement. Let me also add one thing that came out of our small group that I think needs to be added to our overall agenda, either broadly or in the COVID context, and that's mental health. I think mental health has proved, it's always there. It's sometimes stigmatized, it's sometimes not acknowledged, but issues of suicides and people depressed because they're cut off with their families. And one of the things I know that the humanitarian sector has learned about is what they call mental first aid, mental health first aid, that because there's so few mental health professionals in the world. You know, I remember somebody telling me in all of Pakistan, there were like 3, or, you know, so it's a real opportunity for communities to develop mental health first aid systems so that we all can take care of each other. And during COVID, it's been a particular challenge.
Thank you, John. And Diana also mentioned that. Anima, if you can share once, you know, there is any recording or takeaways from the webinar. So Anima attended a webinar on mental health and the effect of the lockdown on it. But, you know, if you can share that, I'm sure that would be of interest. And this is actually a great segue to the next thing that I want to really bring up, which is that we've been talking a lot about internally about where do we head next with these calls? How do we use them to, you know, to create a space that is useful for all of us? One idea that we have had is that maybe we can begin identifying and look at some of these, you know, sectoral issues or other issues on calls individually, or broader issues on calls individually, and look at longer term, what does this mean? What does this mean in terms of what we advocate for when we go out to forums? What does this mean internally in our own work? And what can we share? So that's one idea we've had. And again, I'm completely making this up as we speak, but just as, you know, if mental health is an issue that we need to really focus on and talk about, maybe we can have a call dedicated to that and talking about what's happening, what organizations are doing, what do we need to do about this? Food security, gender, education, each of these could be calls when we are specifically looking at it. Or we could look at it sectoral, we could look at it in terms of the work, like monitoring and evaluation. What does that mean longer term? What does that, you know, what do other things like office operations or fundraising, funding, where the changes need to happen? But we would love to hear your input. So if anybody would like to share what, you know, what they think would be most useful, where should we take these calls? Where should we go with our next calls? Please speak up, unmute yourselves, or put it in the chat box here.
And it sounds there's a lot of discussion in the chat about the issues around mental health. So maybe that's one thing that we have a focused call on, how we can better address that both within our own organizations, but also in communities, and how we can have more access to tools and resources and awareness. So that's one idea.
Perfect. So, yeah.
Hello, can I share?
Yes, please, Lauren.
Good day again to everyone. Here in the Philippines, we started the call for unity among the registered social workers. So we try to administer PSS support across communities. So this is really a very important action on the part of the different associations. The associations came from local social association of local social welfare development organization, then medical practitioners, the frontliners, and then associations in various settings. So all of the social workers are contributing to respond to the needs of various concerns in the community. So if, for example, if there are people who are, for example, there's a lockdown among the in many parts of the country, and it happened that your kababayan or the one residing in your community happened to be in the Visayas region. So it's very easy to bring a creative response to that, because the other team will automatically respond. So it's very fast, only minutes. The responding team can already give adequate response, especially especially during hard times, when there is an urgent need for example, a need for blood donation. So it's easy to access the services once the professionals are
Right.
so that's it.
Thank you, Lauren. And thank you everyone who has also put in ideas in the chat. I think the three things that we see right away are, mental health, gender, and food security. And then also, within each of them, they are integrated. And that's one of the things that we talked about. For instance, in mental health, there's also the added burden that women face. And what has that meant for their mental health? So many things are all interrelated, but we can surface them in our calls. And if you have more suggestions, ideas, if you would like to share your work, please reach out to me or Nelly. Before we have our next call, and we can plan it accordingly. Nelly, over to you for the closing.
Thank you. And John, do you mind putting up the final slide? So we are at just 1 minute before the closing. Thank you all so much for joining and having so much energy, even after we took a little bit of a break from these calls. Some last minute announcements on March 17th. The movement will be holding its first Asia regional call. They've noted how time zones make things really difficult, and a lot of countries in, across Asia aren't able to join these. So starting on March 17th local time, which is for those on Eastern time, would be March 16th night, will be a first call dedicated to Asia member organizations, and it will include presentations from BRAC and Sovardia. So if you want to join that, keep a lookout for an invitation for that. Also, something to be aware of, on March 18th, DevEx is hosting a conversation with the head of the Africa CDC, and that will focus on vaccine rollout across the continent. So that, following on our last couple of calls on vaccines, might be interesting to a lot of you. And our next call will be on April 14th, and I have a feeling it may focus on one of the topics that Gunjan just summarized of mental health, gender, or food security, or the linkages between those. So we hope very much you can all join us, and thank you again for the really rich contributions today. We will stay on just for a few more minutes in case anyone has any last thoughts or questions to share, but otherwise, thank you for joining us, and you are all
Nelly.
free to go on. Yeah, Diana.
Oh yeah, sorry, Gunjan. No, it's just in like announcements into this last part. It's that from March 29 to 31 of this month, we're going to have the Generation Equality Forum in Mexico, and it's also organized with France. But I'm going to put that information in the chat box. But it would be great if some of you could register for participating. We want to make a broader participation into this. I know maybe schedules are going to be difficult for some other parts of the world, but it's a really, really big event for us to define the agenda for gender equality. So I can tell you, I hope that you all can participate. It's in the chat box, and for the information. And yeah, if you need any information related to that, we can help you in the Mexican team, because we're part of the group that is arranging everything. So yeah.
And Diana,
Thank
maybe
you
you
so
can
much.
share the email ID in the chat box as well. If people have questions, they can reach out to you.
Yeah, I will put my my email and Roberto Baeza, which is the focal point from PHP for that. So yeah.
Thank you, Deanna. And that's like also, I'm so glad you brought that up. Also, just to remind everyone that if you have any announcements that you'd like to make at the end of the call, just let us know, or feel free to put it in the chat box or raise your hand. All right, thank you all so much. And we hope to see you next time. Bye, John. Bye, Cassidy. Bye, everybody.
Bye, everybody.
Bye,
Thank
Sam.
you. Great call. Great
Montserrat.
call.
Hi,
Thanks,
everyone.
everybody,
Thank you, everyone,
sharing.
for your participation.
Thank you.
Thank
Bye.
you so much. Angela, you should send us a link to your article. Oh, you're muted.
I'll send it to Gunjan.
Perfect.
Yeah,
Okay.
we can circulate it then. Thank you so much, Angela.
Thanks, everyone.
Thank you. I am going to end this.
Bye, Deanna.